Okay. Yeah. Hello, I am Behruz Kamari Tabrizi. I'm the director of the Sharmin and Bijan Mossavar-Rahmani Center for Iran and Persian Gulf Studies. As I mentioned earlier, in lieu of having public events and other kinds of programs this spring semester, we have decided to have a series of virtual conversations with scholars of different disciplines who work on different aspects of politics, history, and culture of Iran and the Gulf states. Today, I have the great pleasure of introducing to you to Luciano Zaccara, who is not a stranger to our community here at Princeton. Luciano was a fellow here in, if I'm not mistaken, spring of 2018, and many of our listeners and viewers remember his presentations and workshops that he conducted while he was at residence in Princeton. Professor Zakara is a research assistant professor in Gulf politics at the Gulf Studies Center at Qatar University. He's also a visiting assistant professor at Georgetown University in Qatar, and his research is mostly focused on Iranian politics and Gulf politics, international relations in Persian Gulf, and Iran and Persian Gulf states relations, and Saudi Arabia, and he now is in Spain, and as many of us these days are misplaced from our place of work and residence. And from what I hear, Professor Zakara now is at his home in Spain, and but away from the workplace. And I would like to thank you, Luciano, for accepting our invitation to have a conversation about the Gulf states and the COVID-19 crisis. We hear a lot about Iran, and we earlier, a couple of weeks ago, I had a wonderful conversation with Professor Salehi Esfahani about the situation in Iran, and we hear also about Iran in the news. We don't hear much about the Gulf states and COVID-19 crisis, and I thought if you could give us some overview of how this pandemic affected the Gulf states, including Saudi Arabia, of course, and then from there we can talk about different implications of COVID-19 crisis in terms of economy and politics and relationships in the Gulf. And I can't think of any better person to have a conversation with, because I've seen, I mean, many of us have seen you on different media outlets talking about these topics, and I'm really glad that to have you here today to have this conversation. So, Professor Zakara, thank you so much.
Well, thank you very much. First of all, thank you for inviting me, even though it is virtually. It's a pleasure to be again in Princeton. And actually, I wasn't at Princeton at the same time than Javad Salehi, so it was a pleasure also
Oh, fantastic.
to see to watch his conversation as well. So as you said, I mean, a lot of things are said about Iran, and actually, we will mention Iran a lot in this presentation. That, if you allow me to share with you, to tell you at least a description or a detailed explanation of how COVID-19 arrived to the GCC, to the 6 GCC states, and which were the measures that they were taken by all these states. So I will share this to start. First of all, to say that these are the dates in which the first cases were registered in every of the 6 GCC states. The first one was in the United Arab Emirates on the 29th of January 2020, very early compared with the rest of the other states, and even compared with Iran. We remember that the cases in Iran, the outbreak was around the 17th, 18th of February, a few days before the elections. I was there also during the elections. I was in Iran by then. And the first case was a Chinese woman that came from Hubei. So like other states in the region, in the Asian continent, most of the cases, the first cases that they were registered in every country were from people coming from China directly, even from the same province, from Hubei. But if you see the other 5 cases, the first cases that they were declared in Bahrain, Kuwait, Oman, Qatar, and Saudi Arabia, they were all people coming from Iran. And this is an important factor to bear in mind in the future relations between Iran and the GCC states. The first case in Bahrain was declared on the 21st of February, a school bus driver coming from Iran. In Kuwait, 3 days after, on the 24th, the same than in Oman. 3 cases of a national Kuwaiti, a Saudi, and a Bidun coming from Iran. The same in Oman, 2 Omani citizens that they were coming back from Iran, mainly from Qom or from Tehran. We have to remember also that the outbreak in Iran was in Qom, but then expanded to Tehran. In Qatar, the first case was on the 29th of February. Again, a Qatari citizen coming from Iran. And the following cases were also many Qatari citizens. And in Saudi Arabia, the 2nd of March, very late compared with the first one in the UAE, it was also a Saudi national coming from Iran. This gives you an idea that we can discuss later at the end, is how important are the links between populations in both shores of the Persian Gulf, and how difficult it is to cut the links between people. So governments can be upset to each other, but it's very difficult to cut those links, and nothing will prevent these connections between both shore, family links, religious, commercial, to continue. And this, I think, was a clear explanation of this situation in the region. If we go case by case, we will see after the first case was declared, United Arab Emirates started to take some measures in order to reduce the impact of the COVID in the country, but also to contribute to ease the tension that existed mainly with China, since there was a lot of pressure to all the countries in the region to cut flights, to reduce links with China. On the 4th of March, UAE contributed to repatriate citizens that they were stranded in Wuhan from different nationalities, mainly Arab countries, but also from other places, in medicalized aircraft. Internally, measures started to be taken very early compared with European countries. On the 8th of March, schools and universities closed for a month, starting on that day. Emirates started to reduce the frequency of their flights, and on the 21st of March, suspended all passenger flights. So basically, Emirates and Etihad, that they were 2 big companies that actually were the models of the development in the region, were grounded. This represented a huge step taken by Emirates, with a huge impact on its economy, mainly on Dubai. And also they started to take measures inside the country to reduce the mobility of the population. Curfew were imposed on the 26th of March to implement disinfection in the whole country, in public places, etc., etc. A few days later, on the 29th, Dubai Metro and Dubai Tram were suspended for at least 1 month. And at the end, on the 12th of April, UAE started arranging repatriation for Indians and other stranded citizens in the UAE. So meaning people that they were they got stuck in the UAE, the same that happened in the whole GCC. And in their own countries, they were not allowed to enter. I mean, India and other countries, they started to prevent people coming from the Gulf to enter their countries. But there were a lot of efforts conducted by UAE and also by other GCC states to allow these citizens that they got unemployed, mainly because many people that they couldn't, I mean, once the mobility was reduced and shops were closed and restaurants were closed, many of these workers in the UAE and in the GCC in general lost their jobs. So they got stuck in the GCC without job, without income, and they had a lot of trouble to come back to their own country. So in this case, UAE as well as Qatar Airways arranged many flights to repatriate Indians and other people from the east of Asia. In Bahrain, as I said, the first case was in February, in 21st of February, with citizens coming from Iran. More cases that were recorded a few days later were also coming from Iran, but via Dubai, because there are no direct flights to Iran from Bahrain. So one of the first decisions taken by Bahrain was suspending all flights from Dubai and Sharjah airports and to announce a travel ban on Iran. And this produced some controversial cases, like a group of Bahrainis that they came from home and they got stuck in Qatar. And even though there is a diplomatic rift between Qatar and Bahrain, Qatar provided them with accommodation and help until Bahrain government allowed them to come back to the country. Flights also from Iraq and Lebanon were suspended, and checkups for all residents and citizens who travel to Iran started to be implemented. All people who traveled during February, to check how many people actually got infected before the discovery of the first case. On the other hand, like Emirates, Qatar, and the other countries, Bahrain started to implement a package of measures to stimulate the economy. In this case, more than $11 billion were started to be distributed to alleviate the impact of the COVID on most of the population, including residents, foreign residents, for instance, including water and electricity bills to be liberated for payment and for over 3 months. And measures taken in terms of reducing mobility. They started to close all shops, shopping malls, public places on the 26th of March. In the Kuwaiti case, as I said before, 3 first cases were 3 Kuwaiti, Saudi and Bidun citizens that came from Iran. And they took very few days to decide the suspensions of classes. At the beginning, it was temporary. Then the decision was taken until the 4th of August. So in very few days, the Kuwaiti government realized that it would not be possible to re-establish normality in classrooms until after the summer. And this is something that it's already accepted in most of the GCC states. Even in some countries like Qatar, they are considering not starting the semester normally in August or September, but starting in January. And this is something that we can discuss about how this can affect the economy of all these states. The measures that Kuwait started to implement was the suspension of visas for foreigners, establishing quarantine for all people coming from certain countries. Borders with Iraq and Saudi Arabia were closed, so meaning the only borders, the land borders that Kuwait had. On the 13th of March, all commercial flights were suspended, with the exemption for cargo flights. And a public holiday, meaning absolutely no people in the street, was declared from the 12th to 26th of March, with all shops closed and restrictions on restaurants and other places. In another step that is also important to bear in mind related to food security is that food exports were banned. So food security started to become also a concern for all the GCC states that depend on external sources for food. And curfew were implemented from 5 p.m. to 6 p.m. and from 4 p.m. to 8 p.m. during Ramadan. So curfew started to be implemented last month and is still in place in the country. And in the GCC countries, this is the only case in which we had migrant workers protesting because of the conditions that they were treated, and they demanded repatriation to Egypt. In this case, as I said, many countries grounded most of the aircrafts and airlines, and they closed their borders. So people that they got stranded in the wrong place, they were not able to return to their countries. But without job, without income, the living situation of these migrants in the GCC became much more complicated than national ones, that at least they had their own houses, homes, etc., etc. So this is the only case in which we witnessed protest of a specific group of nationals from another country demanding repatriation. In the Omani case, the same. On the 24th of February was declared the first case, and the first measures taken by Oman Air, the national airliner, on the 9th of March was to suspend flights coming from Italy, Saudi Arabia, then later on Bahrain and Egypt, and later on coming from India, Nepal, and Pakistan. Even though these cases were not, this last group of countries were not the ones that they had biggest amount of cases, but there was a measure taken in order to prevent people to get infected in industrial areas in which there is a concentration of workers in a very small place. It's a lot of people living in not the best conditions, and someone infected could have easily spread the coronavirus in the whole region. And this is actually what is the biggest concern in all the GCC states, and actually is what all the governments are trying to tackle. On the 12th of March, tourist visas were suspended. They stopped cruise ships arriving to the country. The sports events were canceled, and shisha was prohibited in cafes and in restaurants. It's not clear what is the relation between shisha and COVID, but I assume that there is a medical explanation for that. A couple of days later, classes were suspended in school and universities like other GCC states. On the 18th of March, borders were closed and only Omanis were able to come back to Oman. And they were not allowed to leave the country, the same measure that was taken in Qatar. So to prevent Omanis to go abroad to get infected, and they stopped the entry of anybody in the country. On the 29th of March, all international flights were suspended. And one of the biggest measures that Oman took in terms of financial aid, is the Oman LNG company provided 6 million of Omani real, which is, I don't remember exactly in dollars, to support the health ministry. So in Oman, in Saudi Arabia, in Emirates, and in Qatar, the governments did a great effort in providing extra financial aid to nationals, to companies, to residents, and even to foreign workers, to prevent the effects of the coronavirus. Qatar, the first case was also a Qatari citizen coming back from Iran, but curiously, the big decision in terms of banning people coming from abroad was taken on the 1st of March, when Qatar bans people coming from Egypt. That again was not a country that had many cases in that period. Very few days later, on the 9th of March, all schools and universities were closed, and the ban extended to 15 countries, including all the Indian subcontinent, Bangladesh, India, Pakistan, Nepal, Philippines, South Korea, Sri Lanka, and also Syria, Iran, Iraq, Italy, Thailand, and China. So at the end of the day, Qatar had to take a decision, even though it was heavily criticized for not cutting all the flights to China and Iran at the beginning. Iran had to reduce the amount of flights. They had to reduce the frequency of flights to Iran, but they didn't cut the flights. So all these banning were to enter the country, but not to transit towards Doha airport to go elsewhere. So flights were still going to all these places, but citizens from those places were not allowed to enter. In few days, cinemas, museums, gyms, souks were closed, and more bans started to come: France, Germany, Spain, and Sudan. That's why I cannot come back to Qatar right now, because we are banned to come back, all the people who is in Spain. The same that happened with other countries. The country adopted a huge package of economic measures to relieve the burdens on businesses. I mean, rents for shops were pardoned, electricity, water bills were pardoned, food started to be distributed mainly in the industrial area and non-privileged zones. Loans started to be easier to get, mainly from the National Bank, Qatar National Bank. And definitively on 16th of March, Qatar bars entry of any foreigner. The same that happened in Oman. Only Qataris were allowed to come back to the country, but they were prevented to leave. Transit passenger may still use the airport. And this is something that also was criticized, the fact that they are not allowing people to enter, but still Qatar airport can be a hub for spreading the virus, because even though the measures to control the passenger are very strict, but so far it was demonstrated that how difficult it is to prevent the spread of the virus in big spaces like that. And mosques were closed as well, something that also happened in the whole GCC context. The same that happened with the Emirates case. Qatar Airways also contributed to repatriate stranded people from many Middle East countries, from Europe, from East Asia. So the fact that they continue flying helped them to assist other countries, including China and Iran, and some countries like France publicly recognized or appreciated that effort in helping people that they were stranded, for instance, in Australia or in China, to come back to France. And this is something that most of the GCC says they contributed to help people that they got stranded elsewhere. Something interesting that happened in Qatar that it didn't happen in other places, or at least I didn't see, that is that in cases in which people were violating the confinement measures that they were taking in Qatar, it was publicly announced. And this happened at least in 2 occasions. And the 2 occasions that this happened were Qatari citizens that they were not complying with the confinement. There was a lot of criticism and controversy, but many people appreciated that the fact that they didn't care about who was the one not complying with the confinement. They were Qataris, so all their names were published in all the newspapers. So everybody knew who were the 14 people in one case or the 20 persons in the other that they violated the confinement. And this was something that a curious fact that I think was worth it to mention. Finally, Saudi Arabia, which is the biggest GCC state and the biggest in terms of connections with other countries and with other risk places, it was the last country in having cases, or at least in releasing the information about the cases. The first one was the 2nd of March. However, Saudi Arabia had taken measures to prevent the spread of coronavirus 1 month in advance of the first case was detected. So even though all the measures were taken, they couldn't prevent the spread of the corona in the country. The first measure taken was on the 6th of February, banning all the Chinese citizens and residents to enter the country, and banning the GCC citizens to go to Mecca and Medina. So we have to bear in mind how important is Mecca and Medina for Saudi Arabia and for the whole Muslim world. So managing the flux of people to these two holy places, mainly reaching the months of Ramadan, it was very complicated for the Saudi government to take those measures. On the 27th of February, temporary suspension of pilgrimage to Mecca and Medina was in place. On the 5th of March, they decided to temporarily close the Great Mosque. Curfew started to be implemented first in Qatif province, which was the first one with the biggest amount of cases, mainly from people coming from Iran that spread the virus in the province. And after a few days, 14th of March, all sports activities were suspended, public places were closed, and at the end of the day, 24th of March, national curfew was imposed nationwide from 7 p.m. to 6 a.m. All these measures didn't prevent, as I said before, the virus to spread. As we can see here, how is the situation until today? The biggest amount of cases, of confirmed cases, is in Saudi Arabia with 31, almost 32,000. And of course, the expectation is that it's going to increase. And the lowest amount of confirmed cases is in Oman. But we know that the way in which cases are counted is very controversial, even in Europe or the US. So this is not the best way to identify how is the current situation. I assume that the best way to identify that is the amount of tests done and the amount of death per 1 million of people. And in this case, Kuwait is the one that's showing the biggest amount of death, 252, but also the biggest mortality rate compared with the people that they was recovered. So 11.3% of the cases, comparing death with recovered cases. And the lowest one was Bahrain and Qatar, even though the curve in the Bahraini case was very big at the beginning. And also the amount of tests that they were conducted. In the UAE, 1.2 million tests, according to the government, were implemented. So the amount of people or the amount of confirmed cases much more accurate than any other country in the region, comparing with the Saudi Arabia that with 34 million people, only less than 400,000 tests were done. And the last data that I think is interesting to compare in all these GCC cases is the death per 1 million of people in the country. So the biggest amount is the UAE with 16 per million, so the biggest rate of dead people. And the lowest one is Oman with only 3 people by every million. This can give us an idea, or more or less a picture about how is the situation of coronavirus. The numbers are not as big as Europe, and this is something that we have to bear in mind. They are not as big as the Iranian case. It's possible to say that the GCC states were more prepared in some aspects, in terms of health systems, or in terms of prevention of some aspects of the spread of the virus, or that they were quicker in cutting ties with countries that were more risky than others. But however, they were not able to prevent the spread of the virus in the whole region. We have many things that we can discuss in terms of challenges, what all this is meaning for the GCC states. But I would love to hear your comments, or maybe to your questions to tackle all these issues that we want to discuss now.
Okay, thank you so much, Luciano. This is so helpful. Can we get out of the screen sharing
Yes.
so we can see each other and have a conversation? Fantastic. So this was really eye-opening, and of course, whenever we talk about the GCC and we think about any issue in that region, at least for me, the first question that comes to mind is the question of migrant laborers. And in so many different ways, one can bring the status of migrant workers into this conversation in terms of economy, in terms of statistics and number of cases, for example, how they are measured. But let me start with this sort of general question about the question of health and economic well-being, because as you know, in most countries around the world, there has been a rather, according to many people, a fictitious binary that people have to choose between economic well-being or their health. Mm-hmm. How do the GCC countries see and approach this question? How do they try to generate that kind of balance between the economic situation and the question of public health?
Well, first of all, we have to remember that these are oil-dependent economies.
That's right.
And they are also migrant-dependent economic models. So if we compare, I mean, the Qatar and the UAE, they have 85% of the population that is non-national.
That's right.
The other much less. I mean, Kuwait 60%, Saudi Arabia I think 35 or something like that. But they cannot. I mean, if they rely on the oil for the state income, and mainly all the economic apparatus is managed by foreigners, they need to provide some security, some assurance to these foreign workers that their economic situation and the health situation will be protected, whatever it happens in the country. Otherwise, the whole economies will collapse. It's not possible to sustain the economies of the GCC states without foreign workers, without migrant workers, whatever is the area in which they work, even if it is construction, administration, oil industry, business, etc., etc. So I assume that in the GCC case, or at least the way in which I see their performance and behavior, is that they provide equal importance to guarantee the economic survival of this group of people, as well as the health of the overall population of the country. There were many controversies about, of course, who would be the most affected in the GCC context in case of someone got infected. If the living condition of the workers, migrants, are not very good, if there are barracks in which 60 or 70 people live in one building, if some 3 or 4 people share the same bedroom, it's almost impossible to prevent the spread of the virus. But of course, the authorities know about that, and they don't want all the workers from one company to get sick and not to go to work for 1 month. So this is also a matter of economic survival. Moreover, when most of these countries, they rely on foreign workers for infrastructure projects, mainly in Qatar, all the schedule for the World Cup 2022 is already delayed because of the blockade by Qatar, by Arabia, Bahrain, and Emirates. Now they are much more concerned about how much this will delay all the infrastructure projects for the World Cup. So Qatar was already prepared for this. I would say that is the best prepared country in the GCC context, but also is the most concerned about how this can affect the economy of the country. And that's is visible in the way that the government was trying to address the needs of foreign workers. It is true that there were many cases in which people got stranded without being able to come back to their countries. Many people lost their jobs. Many salaries were not paid. Many companies were not paid. But most of the government, but mainly Qatar, are trying to tackle this situation with special financial aid to those companies in order to prevent any salary not to be paid. There are cases, of course there are cases. Amnesty reported many cases in Qatar, but also in other GCC states. We mentioned the cases in Kuwait with the Egyptians. In many other cases, there were people that they remain illegal because they lost their contracts, they lost their jobs. Many companies there were not fair enough with the treatment to workers. But generally speaking, I wouldn't say that they are doing a very bad job in terms of securing at least the financial support to their workers and the health support to their workers. They don't want, I mean, any GCC government wants the virus to spread, because this will affect the whole economy and even the survival of GCC.
But that also, I mean, it might not be the right comparison, but often when I think about migrant workers in the Gulf, I think of the homeless population in the U.S. and in a sense, in terms of living circumstances and conditions for these workers. And as you said, how difficult it is to think about stay at home and social distancing measures that is basically impossible to institute under those circumstances. And I wonder whether these measures that were taken by the state really consider these circumstances, and as you said, that they pay the companies to keep the employees, but do we know that the companies actually deliver down the stream? Because these are, in a sense, in a different sense, they're homeless people. That some of them work there with no legal rights. There is no kind of legal protection. There's no labor laws that protects them. And what are the guarantees that the companies would actually deliver the financial aid that the states are providing to the companies, to the workers?
Yeah. Well, unfortunately, things are not as we would like to. But this is true that the pressure that the GCC countries, and mainly Qatar because of the World Cup, are suffering, are making them to at least to be more careful about this kind of things. And everybody knew that once the virus reached the GCC states, the main target would be, in terms of who would be affected, would be foreign workers in industrial areas and construction workers, and also all the pressure and all the attention from international organizations would be placed on these places. So I assume that the way they are trying to do this is trying to extend the inspections and to be more careful about checking what the companies are doing. The problem is there is a network of dependency and kind of corruption that is affecting the whole fabric of the society, and it's very difficult to check on the ground what is going on. And sometimes inspections are conducted by same nationals belonging to the same companies and even the same workers. So sometimes are not nationals from the GCC states who are being the inspectors, because actually the amount of population, national population, to conduct this kind of jobs is not the big amount, and they are relying on nationals from other countries. So, for instance, I'm saying something as an example. One Indian or one Pakistani inspector is inspecting workers from India or from Pakistan, and the company is owned by a Pakistani or an Indian. Of course, with an agreement with the government, but at the end of the day, the management is Indian or Pakistan. So everything is arranged among them, because also the governments, the embassies belonging to those countries, they don't want to have problems, because otherwise they would have problems in bringing workers to the GCC.
That's
so
right.
this is a whole network that sometimes is not preventing corruption to happen, and actually is preventing the defense of the rights of the workers by everybody, by the government, by the companies, and by the national embassies, that they are not effective enough. Because if someone complains, if one embassy complains, maybe they say, well, we don't bring more nationals from your country because you are problematic. So this is something that it's preventing, at the end of the day, workers to be defended correctly. And the fact that there is no labor unions allowed in the whole GCC context makes situations much more complicated. But that said, as I said, I mean, all the eyes are on the GCC states and mainly on Qatar. Everybody's paying attention to how many people is getting infected in the labor camps or in the dorms, how many people is dying, and the figures are not as big as one could have expected under this circumstance. I personally was very worried when the first cases were detected in Qatar. Not the first cases, for instance, the Qatari citizens that they were coming from Iran or from Europe, but when the first cases were detected in labor camps. I thought that this would create a lot of, but it seems that they managed to, at least to keep a group of people confined, and they were worried about the virus to get spread. I didn't hear many complaints about people not being treated properly in hospitals. Supposedly, most of the health systems in the GCC are prepared enough for big amount of infected people, although they didn't reach that level. If we compare what happened in the US or in Europe, I mean, that the hospitals
or Iran,
were
for example,
or Iran, we didn't see that images of collapsed hospital in the GCC.
That's right.
I mean, of course, they are prepared for a different amount, for a smaller amount of people. We are talking about populations that they are very, very small. In Qatar, it's 2.8 million people.
That's right. I was rather surprised when I saw your chart of number of tests, that the UAE has like 1.2 million tests, which is so unusual in relation to anywhere else in the world. I wonder whether these tests were done only on UAE citizens, possibly, or do they test migrant workers, or this is just
I don't have the I don't have the exact information, and you also know that there is a controversy about which test they are counting. You know that they have the quick test, that is a blood test, and the other is has another name, that is like
the swipe.
Nobody counts the same styles of.
I see.
So maybe they are counting both kind of tests, but presumably they are conducted to all the population. I don't think that anybody discriminated. I mean, I know people that they got tested in Qatar, that they were foreigners, that they got symptoms, they went to the hospital and they got tested.
I see. Okay.
The beginning of even in late February, when I came back from Iran, I had another colleague that they came back from Iran with some symptoms, and they went to the hospital and they tested him, and he was Iranian. So I don't see that there is a discrimination about who is tested. I mean, it would be ridiculous, because at the end of the day, I couldn't find exact information about that, but some people was posting about the proportion of national and foreigners infected in the GCC countries. And of course, the biggest amount of cases are foreigners. It's the same proportion of nationals and foreigners. It's the same proportion of infected people.
Infection.
There's one, I mean, at the beginning when the cases started to be informed by the Ministry of Public Health in Qatar, there was a list of people, 1 case, 2 cases, 10 cases, and suddenly overnight it jumped to 250 cases. And everybody was worried about how it's possible that in one day 200 people got infected. And the explanation was, actually we got 2 cases that they were from the labor camps that they were infected. So we went there and we tested the whole compound. And we detected 250 cases that they were asymptomatic, but they had the virus. But we went there and we tested them. And that's why we confirmed those cases. It's not that suddenly 200 cases pop up. And I assume that this is what everybody's worried about even in Europe. We know how many people was tested and we determine the cases based on that. But we don't know how many people is really infected. So statistically speaking, in all the European countries and even the US, they calculate that there are 2 or 3 more times people infected than the people that they was tested. We assume that in the GCC case it's the same. That the amount of cases will increase as far as the tests are being made. But it's surprising that I was surprised as well that the UAE conducted that many.
Yeah,
that's why I'm not quite sure that they are
kind
counting.
of test, yeah.
And they're counting. But it's true that the amount of, as I said before, the amount of dead people by million is very high. So the concern is even higher in the Emirates compared with the other countries. It's 16 per million, while in the other countries it's 10, 6, 4, 5. So it's something that should concern them. So testing more people will allow them to tackle the situation much earlier.
So let me move to a question about more specifically about the economy and oil, because now I think this is really the first time I've ever heard of the price of barrel of oil to be negative, and especially I mean in the U.S. Because of the space storage, and they're actually paying people to take these barrels away. So is there a conversation at the national and regional level about the future of oil? And if obviously we don't see anytime soon the economies that are the most important consumers of the oil from the region going back to normal operations, what's the future holds for these oil producing countries? Are there national conversations happening, and what their perceptions are?
Of course, there are conversations. I mean, moving towards a more sustainable economic model is something that is being discussed in the region. But curiously or paradoxically, all these conversations that they are producing these national visions, Qatar Vision 2030, Saudi Vision 2030, Oman Vision. I mean, all the countries that they are having their own vision that they started to be released several years ago, 10 years ago, in which they decided that they need to move away from oil dependence to diversify the income of the state and to move toward the more sustainable sources of energy. The problem is this coronavirus pandemic catch them in the middle of the beginning of the transformation. There was no time to transform anything. Saudi Aramco was privatized a few months ago. And all this project of moving away from oil got stuck because of the war in Yemen, and second, because of the lack of capacity of the government to convince investors about the transparency of Aramco. And then this pandemic is making the oil price to go down and the exports to go down. So this will delay all the projects, the diversification process that they were implemented in the Gulf. Because as you say, I mean, China will resume activities, but China is already diversifying their sources of oil, gas, or even any other kind of energy resource. They don't want to rely 100% on any country, and not only on the GCC cases. What is helping these countries is that, for instance, the fact that Iran is under a heavy pressure, all the imports from Iran to China were almost suspended or canceled. We don't know when China will restart buying Iranian oil. So all this oil that is not it's not bought from Iran should come from the GCC states. So this will save some time for the GCC states once the economy is getting recovered. But as you said, I mean, the recovery will take a lot of time. I don't know. I mean, the calculations by the European Union is that the economy is going to shrink for 7 or 9% next year, and it will grow a little bit more in the next year, but it's not going to compensate all the loss. So this will mean that the demand of oil will not reach the previous levels until several years. Yes, I don't think this will create a big problem, but of course all the projects will be delayed. Infrastructure, diversification, transformation to the sustainable models. I mean, all the countries, Qatar, Emirates, Saudi Arabia, were already discussing about sustainable economy, knowledge-based economy, moving towards that. But all this needs money. Money now is spent in saving all the projects that they are already active. All these countries that they are providing extra financial aid to national and residents not to destroy the economy will delay the implementation of new projects that will move away from oil. It's almost, I mean, it's very difficult to predict how the oil price will move. We had this last month, the agreement between Russia and Saudi Arabia that made possible the cut in the production. But we all know that this agreement never lasts that much. And if one country needs oil, will try their best to sell it to anybody who is able to. So I don't expect the price oil will go up much higher and soon, at least 1 year, 1 year and a half, 2 years. With the barrel of oil at 20, 30 maximum, any of the GCC states, including including Iran and Iraq outside the GCC, can sustain their economies. I mean, Iran was basing its budget in 70 or 60 dollars a barrel. Now it's almost impossible. But the GCC states as well. So they all need a barrel at least $40, $50 to sustain their economy. And this is not going to happen in 2 years. So will their economy shrink? Of course, they will. But these countries, I mean, the fact that they have most of the population which is migrant, and most of the projects are dealing with migrant workers, they know how they can what they can do to survive. And this happened in 2015 with the previous oil crisis. And many projects were canceled. When you cancel a project, you reduce the amount of workers, and the amount of workers you get rid of are foreigners. So the impact on the local population is almost none. Actually, most of the GCC states, they implement this nationalization of labor force, which means that they try to train and replace the foreign workers with nationals once they are trained. So eventually, most of the higher positions will be occupied by nationals. If there is an external pressure like the oil crisis in 2015, the GCC crisis that affected Qatar and other GCC states, when you need to reduce the amount of workers, the only thing you need to do is to to get rid of foreign workers, because I mean, they will never affect the national population, which is absolutely logical.
That's right.
I mean, there's not the same legislation that in Europe that foreign workers, if you have permanent resident, maybe you are more protected. Here, the contracts are limited. So if there is no more job, there is no problem.
So this is actually in a very twisted way, having this kind of 80% migrant worker population would work into their benefit, that because if they eliminate jobs, basically they're eliminating the big portions of the population.
Yeah. This is a bargaining chip that the GCC governments have to, in order to negotiate or renegotiate the social contracts with their own population. Right. If there is a crisis, they will not be affected in economic terms.
That's right.
So as far as the population is protected, they have their own health system, they have jobs secured.
Yes.
No problem will have. The survival or resilience of the regime is guaranteed.
I want to ask you a question before we end about the, maybe this is more philosophical question, and in terms of the political circumstances now. Do you see any kind of changes in political relations between GCC and for example, between them and then between them and Iran, and in relation to this pandemic? Is the pandemic generating some level of goodwill among these states, or rather it's going the opposite side, that it's intensifying these kind of political contentions there?
I have to recognize that I was very optimistic at the beginning. When you realize that the first cases of the COVID were national citizens from the GCC coming from Iran, and I said before, there's no way they can cut these links. So COVID is affecting everybody, independently from nationality, ideology, religion. Okay, maybe this is a lesson that everybody needs to learn here, that if we don't tackle the situation all together, we will kill each other, and we will not prevent people to die in any place. Unfortunately, this is not being the case. I mean, we saw some different attitudes from some countries. For instance, Emirates was providing aid to Iran, and they made public that they were helping Iran. They sent airplanes with medical supplies, etc.
That's right.
It's not the same that happened with Saudi Arabia, that tried to use this. Iran is spreading the virus to criticize Iran. Right. Also, some countries, they criticized Qatar because they were not cutting flights with Iran, and because they were allowing people coming from Iran to go to their countries. But on the other hand, I mean, Qatar was helping Saudi, Bahraini citizens, and Emirati citizens to go to their countries, because Bahrain and Saudi Arabia, they don't have flights to Iran. So they were helping citizens from Bahrain and Saudi to come back to their countries. What Bahrain did is to prevent their own citizens to come back, and they prevent them to come back, and they force them to stay in Qatar. Qatar says, okay, of course, we will host them until this pandemic is ended. So even though there are some signals that it's possible to take this case with more humanity, on the other hand, everybody's trying to benefit politically.
That's right.
And trying to accuse the other for not cutting ties. I mean, there were a lot of accusations against Iran, why they didn't cut ties with China, or they didn't stop flights from Mahan Air going to China and this region. So, but on the other hand, you have countries that say, okay, if in rough situation these countries were helping me, why should they cut my ties? Why should I do what I don't want them to do with me.
Mm-hmm.
Why I would blockade China, why I would blockade Iran, if these countries contributed to my survival in harsh times. So I'm trying to write something about that, to be more analytical in terms of what could have happened and what is really happening in terms of GCC attitudes among them,
Right.
and GCC attitudes towards Iran.
Mm-hmm.
We have two big situations. One is the confrontation between Iran and Saudi, and the other is the Qatari blockade by Saudi.
Right.
These two situations could have been much better. And I think the COVID crisis happened in the midst of very complicated situation for Iran in terms of the sanctions of the Iraqi state, but also from the possible improvement of relation between Iran and some GCC states after what happened in Aramco and other cases.
That's right.
So this could have been a game changer, but I think unfortunately it's not been.
It's not being, because I was really thinking about how can one read the Saudis' gesture on unilateral ceasefire in Yemen. One can read it very cynically to think of it as a sort of a face-saving measures from the Saudis, that the war is not going that well, or read it very optimistically to think of it as a possible opening that the pandemic is generating to rethink these relationships and possibly come up with different kind of solutions to these conflicts in the region.
I assume that Saudi is also making their own calculations about what is more problematic for them and which battle they want to stop and which battle they want to continue. And I think that in this case, it could be an optimistic approach towards Yemen case that can help even Yemen to reduce the tension. But this is not the main priority confrontation that Saudi Arabia has right now. They have other problems that they are costing less lives and less money, to be honest. And Yemen is not providing them any benefit, and it's all heavy burden for Saudi.
Yes.
So why not doing something that can be even accepted as a good gesture?
That's right. Thank you so much, Luciano. This was so informing, and I'm glad you're safe and sound and healthy, and again for accepting our invitation to have this conversation with us. And,
it was my pleasure.
And again, hopefully one of these days we can bring you back to Princeton and and carry on and continue these conversations in different contexts.
Other things need to change on the American side as well to allow me to.
Of course, we know that. We don't want to enter that realm at this point. Exactly. Thank you so much.
Thank you very much. It was a pleasure.
Bye-bye now.